Oh, apologies. Minister, we've heard about the issues at the mother and baby unit at Westmead with mould. Are you aware of issues at Callan Park in relation to biological hazards for staff? Are you aware of the Gladesville Health Precinct and what issues there are there?
I am certainly aware of Callan Park. I understand the MHCC offices are there, and there has been they are currently working from home, and the office is closed because of mould there. I've met with Evelini Tadros from the MHCC about that, and do understand that they're working with health infrastructure to try and either remediate that space or find another space. I am not familiar or don't recall any issues in relation to Gladesville off the top of my head.
Could you make some inquiries about that and perhaps get back to us later today?
Yes, perhaps. Yes.
Thank you.
If Ms Wood could perhaps do that. Yep.
Absolutely. Thanks.
Thank you. Thanks, Ms Wood.
Minister, you know that the most common presentation at emergency departments for mental health patients is triage as category 3, which means should be seen within 30 minutes. Yet the Australian Institute of Health and Welfare figures tell us that 10% of mental health patients who present at the emergency department are waiting 26 hours for treatment in what we all know is a high-stress environment. What concrete measures are you taking to make sure that no mentally ill person is waiting 26 hours for treatment in our public hospitals?
Yeah, I mean, I agree. Thankfully, New South Wales actually leads the country in terms of the highest proportion of patients seen on time. And I think it's close to 70% of people are seen within 20 minutes. However,
respect, the fact we do better than other states doesn't detract from a 26-hour wait for 10% of patients presenting in New South Wales.
Look, I mean, absolutely. The pressure on emergency departments and the fact that in a small percentage of cases people are without question waiting too long is of real concern. What we are doing is trying to set up an entire alternative framework for people who do not need to be in emergency departments to seek care. There are a number of different components of that. A major component of that is our Medicare mental health centres. These are no referral, no appointment, no fee hubs, which we are co-funding with the Commonwealth and rolling out across New South Wales, where people who would otherwise go to an emergency department who may not need that type of care can seek care. That is one example.
Minister, the funding for the Medicare mental health centres, how much of that is Commonwealth and how much of that is state?
I will have to take on
If you could take that on notice,
Yep.
that would be
Another
great.
part of that, though, are our New South Wales safe havens, which are entirely state funded, and I think there are 22.
And Minister, the hours that safe havens are open compared to the hours that emergency departments are open?
It's not comparable, you're correct, Ms Carter, in that
Yes.
emergency departments are open 24/7 and safe havens are not.
Are safe havens generally open evenings and early mornings when
It
people
varies
might be expressing distress?
It varies a lot. A number of safe havens are and do in fact have opening hours 2 till 9 p.m. or something like that. However, the issue that you are getting at, which is safe havens are not open 24/7, and therefore, you don't always have a crisis in a particular window, in a particular day, is a valid one, and we're sort of exploring what we might do to make them more widely available. But they are all measures to take pressure off emergency departments. And the other one that I'll just briefly mention, which we are really hopeful of getting some significant progress on later this year, is our virtual mental health single front door, the rollout of a sort of a telephone emergency triage for mental health. And that is on track to commence rolling out in districts in a staged way later this year. So
they're great ideas, Minister, but with respect, they're not working, because when we look at the figures, the median mental health patient now waits 3 hours longer in emergency than they did 4 years ago. Things are actually going backwards. What are we doing to make sure that people are being seen in a timely fashion?
Well, as I said, I mean, the initiatives that I have described are relatively new or only just coming online. So that we have the 22 safe havens open now. We have not opened our full complement of Medicare mental health hubs in New South Wales.
How many are you planning to open of
I
those?
think we have 33 in the pipeline for New South Wales.
I'll
but
get
I
the
will
details
take
this
that
afternoon.
on notice.
That'd be great. Another question, Minister. What preparations are mental health clinicians in Justice Health making to prepare for the return of female members of ISIS and their children?
I am not aware of any, but I can take on notice if they have indeed made any or been engaged.
And
in
have
that
you
issue
been
at all.
briefed about preparations for their return?
I have not.
Are you aware that anybody in your department or has been briefed about preparations for their return?
In terms of justice health or forensic mental health, I am not.
Okay, I'll follow up on that this afternoon, perhaps. One of your key election promises was whole of government accountability to save lives, and so last September we saw the passage of the Suicide Prevention Act. What's the status of the 2 advisory councils required by sections 15 and 16 of that Act?
We're just finalising the membership of those at this very moment. We should have that finalised, I would imagine, this month. Just wanting to make sure that all of the different priority populations and voices that need to be heard are included. We've done EOIs. It was an overwhelming number of EOIs, which is great, but then you have the challenge of there's a lot of interest, which is fantastic, getting that down to 13 members, 11 members.
6 months and we don't even have them established. We're still sorting out who the membership is. Is this really a priority for you?
Yeah, it is, because, you know, we don't just want to do a slapdash job. So we pass the legislation, we open the EOIs, we received an overwhelming number of EOIs, which
Do you have a date when they will be established?
I don't have that, but I'm happy to take that on notice.
Okay, and is there a budget already established for them?
So that will be funded through the Mental Health Commission, who's obviously been given charge of the...
So were they given additional funding for that additional responsibility?
I'll have to take on notice if they were, although I've had a number of conversations with them about how this is priority work for them, and that they need to ensure that they are able to manage that.
Sorry, if this is the signature policy, how do you not know when this will begin and whether additional funding was provided?
Well, I just answered the question in terms of when it will begin. I'm actively
take it on notice.
engaged. I'm actively engaged with the Commission in relation to the finalisation of the committees. I don't have an exact date of when we will be putting out the press release. But as I said, I make no apologies for taking really seriously trying to get the balance right in terms of the membership. It actually was very challenging with an overwhelming number of EOIs to finalise a group of 11 members.
Sorry, Minister, I thought a minute ago you said it was 13. How many members?
I'm trying to recall, I can take the time to open my notes. There are 15 members of the committee. 2 of those I understand are co-chairs. 2 are government appointees, and 11...
Minister, I thought this was one of your signature policies, yet you're not really sure of the number, the date.
There are
Starting
15 members of each committee.
Thank
There is
you.
a Suicide Prevention Council and an Aboriginal Suicide Prevention
And the
Council. They
suicide
have-
prevention plans, where are they at?
Well, the plans are to be developed by the councils.
Okay, so when will they be developed, do you anticipate? What timeline are you expecting for this very important work?
I would anticipate that would be done this year.
Which part of this year, Minister?
I mean, as I said, I am not aware of... I don't want to give an exact date, because if I say, well, we'll have it done by June or July or August, the committees are intended to do that work. And that's the entire purpose of setting them up, is to give them ownership and leadership.
And you said that you're engaging closely with the Mental Health Commission. Are you engaging closely with the restructure of that commission?
I have been briefed on that, yes.
And you're supportive of that restructure?
Yes.
Are you concerned that the work in relation to the Suicide Prevention Act is going to lead to job losses at the Mental Health Commission?
No, I'm not concerned about that.
Why is that?
Because we have been clear to the Commission that this is a priority work for them. They're very excited about it. There's no intention that would lead to job losses there. I support their restructure.
But you know that there are people whose positions will be lost in that restructure.
Well, I mean, I can ask Ms. Black to speak
I'll
to
follow
the
up later
restructure,
today, yeah.
but it's completely within the purview of the Mental Health Commission to restructure their work based on the really important leadership role that they have for the suicide prevention legislation.
And the previous mental health and wellbeing strategy, that expired in 2024. When will the new strategy be in place?
I might ask.
So you don't know when the new strategy will be in place?
I don't have an exact date, no.
As Minister, isn't one of your key responsibilities strategic direction of your portfolio? And so you don't know what's happening with the strategy for the mental health and wellbeing?
As I said, I don't have an exact date of when the mental
Do you have
health
any rough
Commission,
idea?
hopes to finalise that.
Do you have any oversight over this at all?
Well, I mean, I do have oversight over it, but that doesn't necessarily mean that I have exact dates of the release of the Mental Health Commission's new mental health and wellbeing strategy off the top of my head.
A rough date would do?
Ms. Black, do you have details of that?
I'd say early 2027 is what we've proposed.
Early 2027. Are you concerned that that will be in the caretaker period and therefore may not get the attention it deserves?
Well, that's a conversation I'll have with the Minister at some point. We've tried
I'll come back to you in the afternoon, Ms. Black. That was really a question for the Minister, to be honest, in terms of timing. Minister, we've talked about this before. Do we now, or do you now have a final figure for how much was paid to VMOs and to locums to fill places left by staff psychiatrists who resigned during the dispute last year?
The figures that I have, the indicative costs related to the contingency measures for the period of the dispute with our psychiatrists were that the cost of that was 18,412,572. That includes the virtual psychiatry hubs, other incremental costs, and the mental health acute assessment team. I don't believe that I have here a specific figure in relation to VMO and locum costs, but I can see whether or not that is something that I might
Minister,
be able
perhaps
to...
you can come back with that later today. Can I say I'm surprised that you don't have those figures available given our previous discussions?
Just
I'm
on that, in
constantly
terms of
confounding
sort of
you, Ms.
numbers
Carter.
of psychiatrists,
Yeah, is that measure, Dr. Wright, to increase security? Is that a short-term measure or that's a permanent measure?
Ms. Carter, I don't know that I can say whether it's permanent or not. I think that I think the review that we're doing, if the finding is that looking at peer-related services like between Western Sydney and South Western Sydney, that in order to there's a benchmarking process, and it's not just about the staffing, it's about the roles and responsibilities, it's about the orientation of security staff, all those things. If they find that what has been happening historically is less than what's happening in other districts, then I'm sure they'll be long-term strategies.
And I think, Ms. Carter, if I could as well, obviously the Cumberland Hospital site physically is more challenging than some of our other sites, and we do obviously have the new build opening, but it is, as to Dr. Wright's point, the reviews will really identify for us if there is a need to look at the staffing profiles, not just of security, but we're looking at all of the staffing profiles to consider that. I will just state
So
that
there'll
they
be
were...
8 security staff until the review is complete?
I think, Ms. Carter, we're still undergoing that process at the moment, so I can't commit to that because that's underway at the moment.
On notice, could you provide the time period which you currently have engaged additional security staff for and when that time period is expected to end currently?
We can certainly advise when we put it in place and most definitely how that is being considered in line with the work that is underway daily.
But is it in place for a specific period of time or is it ongoing?
Well, I think
my
that's
question.
what I'm answering, Ms. Carter, is that we're reviewing that at the moment based on the needs of the site.
And I'm asking, so when will you decide to have maintain that security staff or reduce the staff again?
Well, as the review plays out, when that becomes evident, then the decision will be
So
made.
my initial question was there'll be 8 security staff in place until the result of the review. Is that correct?
I think as I'm trying to explain, that it's a dynamic and evolving situation. So we look at it every day in terms of the rostering.
So security numbers can change every day at Cumberland?
Well,
Is that what you're saying?
rostering for health staff does change and fluctuate on different days. Yes, that's a standard normal
So
staffing
how many
profile.
security staff are in place at Cumberland today?
I would have to take that on notice.
If you could take on notice, how many staff are rostered on every day for the past week and every day for the next 3
Sure.
weeks? I'd be very grateful.
I think
Thank
we
you.
can definitely put that on notice.
Thank you. Dr. Wright, I think you said that your team met with the acting general manager. Did you also meet with the clinical director at Cumberland?
The acting clinical director wasn't at that meeting.
Is there a reason for that?
Not to my knowledge. We met with whoever Western Sydney wanted to bring to that meeting. You will appreciate that the meeting was organised at very short notice, and we were keen to get in there to view the services, and there were plenty of things that we needed to follow up and deal with without necessarily having to include.
So I'm just curious, I think you said the acting clinical director, and if I'm right, I think you said the acting general manager, and the executive director of mental health, is that also filled by somebody who's acting in that position?
So I'll just answer that, Ms Carter. We are in the process of appointing to that position.
So
for the
how
mental
many
health
of those
director.
positions in the chain of responsibility for Cumberland are filled by acting, and how many are filled by permanent people?
We'd have to take that on notice.
Could you take that
Absolutely.
on notice? Because that's just, I find that quite curious.
I would just say, Ms Carter, that there's been some challenges in Western Sydney. There have been changes in leadership. What we have seen in terms of, and notwithstanding the tragic events that have occurred, and absolutely the staff, as we all are devastated that that's been the outcome. We do have an acting general manager. We're about to permanently appoint to
Right.
that.
Thank you.
But I think in terms of what we have got going forward, we can take that on notice.
Thank you. Who can answer questions about the Gladesville facility in Cullen Park?
Perhaps if you start asking the question, Ms Carter, we can work that
So
through.
the Minister this morning indicated that because of contaminants that had been found, staff were currently working from home. I wondered what exactly were the contaminants which had caused that direction to work from home, and for how long had staff been directed to work from home?
All right, I will have to take that on notice. Sorry, Ms Carter. I know
Thank
I've got
you.
something that's come through somewhere.
And I'm also curious how those contaminants were identified, when any remediation began, who was responsible for the remediation, did that remediation involve any attention to the HVAC system, and what the cause of each of the contaminants is believed to have been.
Thanks, Ms Carter. I think we will take that on notice. There's obviously a lot of work underway at the moment, and I think as we reflected on Monday and continue to reflect, there is work that's underway, remediation works. There is an extensive list of those things, so we'll take that on notice.
Thank you. Okay.
The changes at the Northern Beaches Hospital and the impact on mental health services, I'm just wondering whether someone could let me know whether there would be any anticipated reduction in the current level of mental health services at that hospital when it transitions to public hands?
I'm happy to answer that. We will take the details on notice and get back to you, but that is not my current understanding.
Sorry, I just can't quite hear you.
Sorry, we'll take the details
Yep.
specifically and get back to you, but that is not my current understanding of what the new arrangements would look like.
Because one of the things that has been raised with me by sort of senior clinicians at that hospital, particularly around some of the impacts in the emergency department, because there are a number of mental health beds available. I think currently there's 61 mental health beds across 4 specialised wards. They're a mix of public and private as well, and short stay crisis health admissions. So in practice it means that for the ED staff, the nurses and the doctors, when they do have people presenting with those mental health challenges, there's somewhere for them to go, and that I think makes it a better experience for certainly for the patients, but also for the staff. And again, if you need to provide it on notice, that's fine, but any clarity around how that will potentially be impacted. I think the staff are quite keen to understand what will still be available for them. I understand the government's announced changes to the surgeries for private
Yeah.
patients to extend into 2027. Are there those sort of conversations about mental health services as well?
The surgical situation is a lot more complex in the sense of some of the statewide services. My understanding is that there will not be significant changes to the mental health bed base.
Okay.
I think it's a legitimate question for the community to ask, and we'll come back with details around that.
Okay, that would
Yep.
be great. Do you want to?
Yeah,
I've only got 40
I
seconds.
just sort of
so-
quick one about the
Okay.
closure of the subacute ward at Shoalhaven Hospital. I'm wondering how those patients are being cared for during the closure.
My understanding is that hospital, the entire site, is undergoing a significant redevelopment, and that their options include transfer to other acute or subacute beds within the Illawarra
And there are
district.
beds available
There-
for
yes.
patients to be transferred
Yes,
to?
or
Right.
care in the community as appropriate. Yeah.
And I understand the refurbished hospital will increase mental health beds in what's described as a staged rollout.
Yes.
When will the stage rollout catch up with the number of beds that are presently available before the closures?
I'll take that on notice.
Thank you.